So this is another video in regards to COVID. I wanted to make this video because I wanted to show something that I consider to be bad science. So this is from a CDC website, latest about comparing the previous infection, protection impaired by previous infection versus protection that you get through the vaccine. And basically what they are saying is that this new data shows that vaccine is much more protective than previous infection, which is out of line with previous studies, much larger studies. But I wanted to show a few. It's a very convoluted paper with very difficult statistics that, I'll be honest, some of it I really don't understand, but the error is obvious, so I wanted to show that. So I wanted to first start with their conclusion. All eligible persons should be vaccinated against COVID as soon as possible, including unvaccinated people previously infected with COVID-19. There was a large study in Israel that came to a much different conclusion, and they do mention this that study here, so I'll give them that. But in any case, I wanted to show a couple of things. So they go through a description of the process. And it's very, very difficult and convoluted description. I had to read it several times. But what I wanted to show here is this part. So a total of 201 hospitalizations for COVID-19 like illness were identified. Right? So 139,000 patients were hospitalized after COVID-19 vaccines were generally available to people in their age group. Blah, blah, blah. So first of all, they're talking about COVID-19 like illnesses. So this is not diagnosed, okay? So I'll get to that, but I wanted to show that part. So, and here it is. So out of 6,328 fully vaccinated hospitalizations for COVID-19 like illness. So people fully vaccinated, 6,328 fully vaccinated people were hospitalized, and among these they actually were able to confirm 324 of them with COVID. Now 1,020 people who were unvaccinated but previously infected were hospitalized with the same diagnosis, COVID-19 like illness. And out of those 1,000 people, 89 of them were actually swab positive for COVID. So what they are concluding is, because this number is greater than this number, that means that the vaccine is more protective, because out of all these hospitalized people, the percentages are greater. And that, my friends, is bad science. And I'll just kind of go down here to these tables and show that one more time. So, characteristics of COVID-19 like illness, hospitalizations among unvaccinated adults with COVID-19 infection. So they're comparing the people who had infection 3 or more months before the index test date, and among adults who were vaccinated along the same timeline. So how many people who were unvaccinated but were sick previously, how many of them got hospitalized with a COVID-19 like illness? 1,020. How many fully vaccinated people got hospitalized with the same COVID-19 like illness? 6,328. So you can see, so I think if these numbers were reversed, they would say clearly the vaccine is much better than previous infection. So if you had 6,328 hospitalizations of people who had COVID previously, and only 1,020 who were vaccinated, then I think they wouldn't go into in-depth statistical analysis. They would just say, look, here's your proof. But that's not what they do here. So then they go to this number. So they test these people, out of all these hospitalizations, they test these people, and only 89 of these are positive of people who had COVID before now have it again, and 324. So the hospitalizations of people who had COVID before are much lower than those that were vaccinated before, but the percentages of positive results is higher, and that's what they're hanging their hat on. Now, what I couldn't find here is, out of what population sizes are we pulling these numbers, although half the country is still not vaccinated. So I think, and we really don't know how much of the country had COVID before, so that's a limitation of this study. Goes through just a bunch of nonsense where they got the data, and then here they come here. So again, fully vaccinated 6,000, 5.1%, and unvaccinated 8.7%. So it doesn't matter that the general numbers are lower. They put the odds ratio. So this is your increased risk. So this is how much more at risk you are. That's the number they're using. So they're saying that you are at 5.49 times more at risk of getting COVID and getting hospitalized with it, basically, if you had it before and are not vaccinated. Even though these numbers are much higher, it is these percentages that they are hanging their hat on. But these are the numbers. So this is the number, how many people who were fully vaccinated ended up in a hospital, and people who were not vaccinated but had COVID who ended up in a hospital. But yet here, this is what they're saying. So I find it pretty dishonest, to be honest. And then you have the same thing again. Basically always the same thing. I'll show one more thing, and then I'll end this video. So here you are, fully any mRNA, so now they're comparing any vaccine with unvaccinated, and again, this is the numbers you're drawing from, and they give you this odds ratio that you have an increased risk, which I think is very, very dishonest. Let me see if there's anything else. They go through the vaccines, they go through the age groups, and that's it. So I just wanted to show this because you saw basically the claim, right? All eligible people should be immediately vaccinated regardless if they had COVID or not. And then when you look at the data, that's really not the conclusion you would really get. An honest person would not get that conclusion. More people who were vaccinated but did not have COVID were hospitalized with this COVID-19-like illness, and more of them were actually diagnosed with COVID, but out of the hospitalized people, more were actually diagnosed with COVID. So you don't even know what they actually had. It sounds like they're just assuming that all of these people had COVID, and because they assumed that all of them had COVID, and just a greater percentage of people who had COVID previously, even though there's less of them, because the greater percentage of the ones they assumed had COVID tested positive for COVID, now immediately they make this conclusion, and it is just a certainty that they express this as a certainty, and that is not honest. That is not honest, especially in light that we have far larger studies that say completely opposite. And that's what I wanted to show. So when people read these headlines like this, and the reason why I came on this article is because I get an email for a hospitalist for doctors who work in hospitals, and it was about vaccines, and this is where I saw it. So so these people read these headlines, and then they look and they say, well, New data from the CDC say that people who have had COVID but never got vaccinated are 5 times as likely to get infected again when compared to fully vaccinated people who were never infected. And that is dishonest, and now this is being propagated, and I just wanted to show what kind of data this is based on, because this is, I think this is really bad science and dishonest science, and I understand they want to get more people vaccinated, but this is not the way to do it. This is simply misrepresenting data. And I guess that old saying of there's lies, damn lies, and then there's statistics holds true. So that's all I want to say.